It is our monthly get-together with Dr. Gary Vander Vliet of Advanced Dental Care here in Hackettstown and serving all of Northwest Jersey. Dental implants are the topic of the day that we're going to cover. And Doctor, welcome back. Good to see you again.
Thank you, Bert. Good morning.
Now, we have our get-together once a month. I think of it as a checkup, but for someone who is undergoing your excellent dental care that you offer, it's not a monthly thing. Maybe 6 months every year for someone who's in good shape.
Usually we see them every 6 months.
Just to make sure that things are good, right? 6 months is enough time to go, and then you see them again?
Usually. Some people we see every 3 months.
Okay. Everybody's different,
Everyone's
right?
different.
Okay. Excellent. Dental implants. We want to talk about that today. And I even asked you off the air that are these moving dentures out of the picture as a potential replacement for natural teeth? Or do implants and dentures, will they be able to survive harmoniously? And depending upon your situation, one might work for you better than the other choice.
Sure. Yeah, dental implants were one of the greatest innovations in dentistry in recent years. It helps people replace missing teeth and replace people that have existing dentures. You could have dental implants and have an implant-supported denture, implant-supported teeth that stay in your mouth. They function much better. You could speak more clearly, chew much better. It's like a 95% improvement of what you have without teeth.
Both of my parents, Dr. Vander Vliet, had dentures, and I can remember them. They had these tubes of paste, and they would be like cleaning the dentures. And
it could be very annoying.
It was a lot of work for them.
It is, and they move, and they don't function as well, and could be uncomfortable as well. Implants could replace dentures. It also could replace an individual tooth. You lose one tooth. For instance, I myself have 2 dental implants. I broke 2 teeth in the past, and I have 2 implants, and it's like a perfect replacement. Dental implants are actually a replacement of the root of a tooth. So the implant is placed, and then you place a tooth that actually screws into the implant. It's fixed to the implant, and it stays in, and it looks like a normal, regular tooth and functions like a tooth.
I could just imagine someone who maybe for years hasn't been able to just simply bite an apple and be able to enjoy that because they're afraid, I don't know if my teeth can hold up, or maybe, a nice roast beef sandwich on a hard roll that you're afraid you can't bite into, right?
Yeah, can't underestimate that.
Yeah, that's important. Are we talking about thousands of people? How many people have had implants?
Oh, sure. Dental implants have been placed. Over 1 million dental implants every year are placed in the United States. Worldwide, many millions of teeth of implants have been placed. So it's really mainstream, and the procedure's very straightforward. First, we determine if you have enough bone support to support an implant. And so we take a special cone beam x-ray, it's called. It's a 3D, almost like a CAT scan of your teeth. So we could determine the quality and the amount of bone you have. And from that, we do scan your teeth with a special camera. We make a digital model of your teeth. And then we merge those 2 technologies together, and we come up with a surgical plan. And then we fabricate a surgical guide that fits over into your mouth, and we accurately place this implant. It goes exactly where we want, the angulation, the depth, and it's perfect. We make a small circular incision, and it's a very comfortable procedure. It's just done under local anesthesia, very minor discomfort, and it usually will stay in your mouth approximately 3 months, 4 months. And the bone will actually integrate into the implant. It becomes part of your jawbone. And once it's secure, then we could uncover it and place a tooth onto it.
Wow. It sounds like it's something that's immediately comfortable. Sometimes you'll get a filling, or you'll have a little bit, maybe a heavier procedure done, and it's a little bit of an adjustment, if you will, on the part of the patient. But this sounds like it's instantly ready to go.
Almost ready to go. It's maybe a couple of days of minor discomfort. Ibuprofen or Tylenol will take care of that, and it works out extremely well.
And then to just have that beautiful smile again and be able to eat all the great foods that you've been missing. It's such a great change.
Especially if people, unfortunately, sometimes have to lose almost all their teeth in one arch, an upper or lower arch. And what do? The older alternative was complete dentures. So now we could, in one visit, extract the teeth, place the implants, and then we attached the new provisional prosthesis or that's screwed into the implant, and works out extremely well. You look better, you could chew better, function better, and just be healthier. One problem is people lose their teeth. They don't chew as well. They don't get enough nutrition, and they start to deteriorate physically. So if you can chew your food well, get enough nutrition, it just makes you healthier.
Yeah, and just a reminder of just how the condition of our teeth, doctor, impacts our overall health. It's really the two go hand in hand.
Absolutely. People with healthier teeth survive longer, at least 7 years longer than people without teeth.
That's amazing. Wow. Dr. Gary Vander Vliet is my guest here on RNJ this morning. We get together once a month, talk about some things happening at Advanced Dental Care. Dental implants is the topic this time around. And you mentioned one of the first steps of the process there was about bone support. Now, if someone doesn't have the adequate bone support, that's nothing that you can do to enhance, right?
Sometimes we can.
Can you really?
Yes.
Wow.
Especially when we extract a tooth, say the tooth has to be extracted. When we extract a tooth, we place what's called a bone graft. It's granular bone that's placed into the tooth socket, and when that's sutured closed, so that becomes integrated into your jawbone, and that has to stay in your mouth approximately 3 months. Then we come back, we take that 3D x-ray, make sure there's enough bone support, then we'll place the implant. Sometimes the ridge can be augmented with other grafts if you do not have enough bone support, and that works out well as well.
That's really amazing that even if they don't have the bone support, well, you can help them with that and get it where it needs to be so that they can qualify for the implants.
Absolutely. There's so many advances these days. It's incredible.
It really is. And appointments, you're taking appointments on an ongoing basis. Someone can reach out now and start this process, right?
We can. And we also do complimentary consultations. If you're thinking about it, give our office a call. We could... you come in for a complimentary, no risk, no obligation consultation, and we could discuss it, see if you are a candidate.
Yeah, excellent stuff. Brush, floss, rinse every day?
Absolutely.
Before bed, so you brush your teeth before bed. Is that a good habit for kids?
Yes.
It is.
Before bed, when you wake up after breakfast, is a good time to brush your teeth, and also before you go to bed, definitely. You want to have a nice, because your saliva flow decreases at night. So if you have any bacteria on your teeth, they do more damage at night.
Okay. Good to remind people of the basics, I think, too, when we get you in here, Dr. Vander Vliet.
Brush twice a day, floss once a day.
Excellent stuff. Thanks again for coming by.
Thank you, Bert.
We'll do this again in July. Look forward to it.
Look forward to that.
And good stuff. But reach out to your office for more information.
Yep.